for joining again. Welcome back to Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and answer your questions. Today we're going to talk about brachioplasty or arm lift. This is a surgery that is not very common, but I think it's getting more and more common when we're seeing an increase in weight loss patients, and it's getting more and more popular. But I'll talk a little bit about why it's not very popular or why people hesitate to get the surgery done, and a little bit about the post-op care and what things we can do to improve the results, okay? So let's start by describing what's the surgery. So an arm lift is and skin excision surgery. So it's basically focused on getting rid of excess skin in the upper arm, from the elbow to the axilla, okay? That's the regular brachioplasty, and it's an incision that goes from the axilla to the elbow. Where do we see it, or where do we need it? In patients that have moderate to severe skin laxity. If you have mild skin laxity, then there are other less invasive alternatives, and I'll discuss a little bit about that. But if you have moderate to severe skin laxity, then you'll benefit from an arm lift, okay? So this is an example of a severe skin laxity on a patient with massive weight loss after bariatric procedure. She had excess skin from the elbow to the axilla, not much in the lateral chest, but this bothered her very much. So what are the alternatives when we have a patient with this amount of excess skin? Not many alternatives, right? If we do liposuction or any radiofrequency treatments like is body type or GE plasma, the amount of skin retraction we're gonna get is not very severe. So if she decided to have done liposuction only, we would see like maybe up to here of an improvement. Not very much when you just evaluate the long-term results. And the flappiness is one of the things that I see the patients like, I hate it. When I'm moving my arm, it flaps around. I can't wear the shirts or the clothing that I want, the dresses, it flaps out. So when I have those patients like that, then you're gonna be a very good candidate and you are gonna be satisfied with the surgery, okay? And this is her, I'll show you guys her 6-month result. And you can see that the incision heals very nicely if you take good care of it. This unfortunately is not 100%, right? We don't really know how you are gonna heal. But there are things that we can do to try to improve the healing, right? And you can see very, very minimal scarring there and a great contour of the arm. She is super happy with her results. But why is she so happy with her results? Because she was a good candidate, right? We have to go back to what bothered her, which was the flappiness, the getting her clothing to fit, and all of those things we're not going to improve with another surgery, just this one. So the incision and the scar then is something that she can tolerate because she's so happy with the new shape that the scar is just there, and we can, in her mind, she's happy with the scar because even though it's noticeable, because it's very hard to hide the arm lift scar. It's just an area of our bodies that if you're wearing a bathing suit, if you're wearing a sleeveless shirt or a short arm shirt, it's gonna show. And I'll show you a little bit about that. But if you are in the position that you are tired of your arm skin, then you're gonna be okay with the scar showing a little bit. And more so if it heals so nicely, right? So what can we do? Oh, let me talk a little bit about the extended. So what is an extended brachioplasty? An extended brachioplasty is when we have extra skin that extends the boundaries of the axilla to the elbow area, okay? So I'll show you a picture here. This is a massive weight loss patient. Skinnier patient, she had lost a lot of weight, but you can see the excess skin in the arm that it extended to the lateral chest. Sorry, thank you. It extended to the lateral chest, and you can see the excess skin hanging there and she could, whenever she put a bra, whenever she tried to put something, it flipped over. So this bothered her a lot, okay? So what is an extended? An extended connects the incision past the axilla towards the lateral chest to get rid of that excess skin, okay? So you can see it extends from here past the axilla to get rid of that excess skin in the lateral chest. Okay, getting it there? Okay, I'll show you another picture that it shows better, okay? In a different angle that you can see better here. You can see better the incision passing the axilla, and she had a breast lift as well. So whenever I have a patient that's getting a breast lift and a brachioplasty and she needs an extended brachioplasty, what I'll do is I connect the incision from the lateral part of the breast lift incision, lateral chest, curve it up and get it throughout the axilla past the elbow. And that way we can get rid of all that excess skin towards the breast, okay? So this is an extended. Not everybody's a candidate, but a lot of people, especially massive weight loss patients that have a lot of excess skin there on the sides, this is an alternative to get rid of that, okay? Position of the scar. This, I think, is one of the most important things of the brachioplasty, right? So where do we position that scar is very important to try to hide it. Like I said, brachioplasty, arm lifts, the downside of that scar is that depending on your clothing is going to be noticeable. But where do we put the scar? It's going to be super important to try to hide it as much as possible. So if you can see the pictures that I showed you, I try to put it in the bottom aspect of the arm, which means the dependent position. Not here. When you're going like this, it's not going to show in the arm. It's going to be in the bottom part. Okay? So when your arm is on your side, that's going to be on the inside of your arm. It's not going to be showing. But definitely if you're waving, if you're raising your arm, if you go like this on the back, you're going to notice it and you're going to see it. Okay? So it is something that we can kind of manipulate in a way that it's going to be less noticeable, but it's impossible to make it that it's not show in any position of the arm. Especially the upper arm is an area of our body that tends to move a lot. The rotation of the upper arm is very drastic when we compare to other areas. Like if you compare your arm to your foot doesn't move as much as your hand, right? And it's because that's what we need for range of motion. So it's just an area, again, that's going to be prone to have visibility because of the movements. So in this way, this is a way to try to make the scar less noticeable as possible. So the position of the scar, I think it's paramount, super important. Let's talk a little bit about wound healing. So what is one of the most difficult things for the scar to heal? It has to do with the arm itself. So the arm is a cylinder, okay? Whenever we do surgery, there is going to be swelling. 100%. That's guaranteed after any surgery. But if we're doing surgery in any other area of the body, the swelling kind of has room to spread or to kind of put tension elsewhere, not on the incision. Let's for example, the breast, right? If we have swelling in the breast, we have the entire chest to kind of spread that swelling. The abdomen, the entire torso to kind of spread. The bottom, the entire hip, legs to kind of spread. The arm is a cylinder. So if we have swelling in the arm, it's definitely going to put tension on the scar. So that increases our risk of having wound healing problems, which is one of the complications of this surgery, which is higher than any other plastic surgery. I think thigh lifts and brachioplasty, those two are the surgeries that are more prone to have wound healing problems, and it's because of the same thing. The tension that the swelling puts on the extremity goes directly to put tension on the incision, okay? And whenever we have tension, that turns into a thicker scar. So that long term is one of the things that we can see with brachioplasties. Brachioplasties, you can heal very nicely in other areas of the body, but we tend to see that the brachioplasty scars may heal thicker than any other area. Has to do with that, okay? The tension in the healing is going to cause the scar to get thicker, to get hypertrophic, okay? So what are the things that we're going to do to try to decrease swelling, okay? One is the amount of skin that I excise, okay? So even though people are like, just take it everything as tight as possible, that is not possible with the arm lift, okay? There are nerves, arteries, veins that are extremely important for the functioning of your hands that pass through the arm. And we need those arm nerves, arteries, and veins to be without compression. So I can tighten the arm to a certain degree, but you're always gonna have some laxity as a result of an arm lift. And it's because to preserve all the function, very important functions of the hand and arm, okay? So that's one thing. The other one is the post-op, okay? So compression garments are super important to try to decrease that swelling. At first, I'm gonna put you in an ACE wrap, which is an elastic wrap. It's gonna wrap around your arm, okay? Put it not just at the elbow, just a little bit lower than the elbow to kind of get all that swelling compressed. And for sleeping, it's very important the position of your arms, okay? So if you sleep on a dependent positions with your arms like this, you're gonna wake up with your hands super swollen. So I always tell my brachioplasty patients to put pillows under their arms so they can sleep in this position, okay? If you sleep like this, your hand is going to be very swollen, and that's going to put more tension on the scar. You may have wound openings, and then in the long run, thicker scar. So pillows like this, at least for the first 2 weeks where the swelling is the greatest, okay? At 2 weeks, then we can switch to an arm garment, okay? And the arm garment is like a sleeve that you're going to put in. At a week out, we can start using that if we don't have any openings. And you're going to use your compression day and night for 6 weeks. And then from 6 weeks to 3 months, you're going to use it for 12 hours a day, okay? And that's going to help with the tension, the scarring, and decrease wound healing problems. Even if you do all of this, they may still be some wound healing issues. Usually, if there are any wound healing problems, 99% of the time, we treat it with local care. Local care means putting an antibiotic ointment, gauze changes, it heals on its own, okay? So don't get scared if you see an opening in your brachioplasty or arm lift incision, just let us know, but it's just putting an antibiotic ointment and gauze changes, okay? So wound healing, it's one of the tricks with brachioplasty, but it's not impossible. And we can definitely manage the swelling. Also your diet post-op. So it's important to have a low salt diet to decrease swelling. If you eat salty after surgery, swelling is going to increase, and that's just going to complicate your recovery, okay? Scar treatment, that's super important, and with the scar treatment goes avoiding sun exposure, okay? So the scar treatment you can start as soon as 2 weeks post-op. Very important that you start it once all the incisions are healed, okay? If you do have any wound openings, you have to wait until that heals. Scar treatment is we're treating the scar. There needs to be a scar, okay? Scar happens after the incision heals. So 2 weeks or whenever it's fully healed, we can start scar treatment. Scar treatment, the one I recommend, silicone-based scar products, okay? Those are the ones that have been shown to really improve the scar long term. They come in 2 forms. One is the silicone tape and the other one is the gel. Both are equally effective, okay? The difference between the 2 is how you put it on, okay? So it's a personal preference. The gel, you apply it over the incision and massage the incisions twice a day. And the tape, you just put it over the incision and leave it on for 23 hours a day. So basically, just remove it for shower, okay? Again, both are equally effective, whatever you prefer, and it's more comfortable for you. On the sun exposure is super important. And this goes to any scar, right? I put it here because brachioplasty is an area that it's harder to cover. So it's going to be exposed to the sun more than the breast, right? We're not walking shirtless, or I hope that you're not walking shirtless. In Miami maybe, but in the arms is an area prone to be exposed to the sun more, especially if you live in a warm area or you're getting surgery in the summer. So it's super important to be very strict with your regimen of sun protection, okay? So if you can wear sleeves, it's even better, but if not, after 2 weeks, you can start applying sunblock, at least an SPF of 50, so you have good protection. Sun is, or UV light, the scars, once they're healing, they tend to absorb more light. It's just, the scar is basically the cells are metabolizing more to heal them, okay? So that high metabolism turns out that they absorb more UV light, so they can get darker. And that's why you see long-term maybe scars that are darker. It's because of that sun exposure early on. And that sun protection is up to 1 year, okay? So even if you had the surgery 10 months ago, you're going to a cruise, still be very judicious about your sun protection to get those scars to not get dark or hyperpigmented, okay? Paresthesias, what are they? Paresthesias is basically the numbness, tingling that happens after surgery. That may happen after any surgery, but like I said, in the arms, we have a lot of nerves that go and give sensation and function to the hand. So paresthesia is a possible complication after arm lifts. The most common paresthesia, and I'm not talking just in the incision, paresthesias along the incision are very common, and that's going to happen in any incision because there is cutting of the superficial nerves that go to the skin, and there's some healing of those nerves. So it's very common to feel itching, pins and needles kind of sensation around the scar, and that's going to improve. One of the paresthesias that you can see after an arm lift is injury to one of the nerves that gives sensation in the forearm, okay? So that's one of the reasons why I can't be so aggressive to tighten that much the upper arm, because then you can end up with numbness or problems with tingling or chronic pain in the forearm, okay? So that's very important to understand on the arm lift, okay? And one of the most common questions, lipo, body type, or excision, and we go back to what I was saying at the beginning of the talk, that the most important aspect of this surgery is your goals, okay? So I think the majority, I would say, 95% of the brachioplasty patients that I've had are happy with their results, and that is because they were so unhappy with their arm that they can tolerate the scar. And I think that is one of the most important things, okay? The scar is gonna be there, okay? And it's very difficult to hide at all times, and it's gonna show at some point in your life, depending on if you're going a night out to a restaurant, it may show. But if you are very unhappy with your arms, that you don't even put a dress on because you're hiding your arms, then you're going to be happy with that scar because your arm and the contour of your arm is so improved, okay? So if you are in the mild to moderate skin laxity, but you are still not okay with the scar, lipo body type is an option. But you do have to understand the limitations of the lipo and body type on the arm. I would say if you have this contour on the arm, right? This is your arm, this is the axilla, this is the shoulder, beautiful drawing, this is the elbow, okay? So if you decide to do body type, in this here would be a 100% improvement, and this is with an arm lift, right? We're cutting all of this excess out and tighten it. With the body tight lipo, you're gonna see approximately a 50% improvement in the contour, okay? So you're not gonna get this tight, you're gonna get more or less half of that. This is an estimate, and it's impossible to measure you and say this thickness is gonna end up, because skin elasticity, healing is very different from person to person. Or a more or less estimate is the 50% rule with BodyTite and lipo, okay? I'm gonna show you I think I have 2 more pictures that I didn't show you guys. One has to do with the wound healing and the scars, especially in fair skin patients. This is a patient with massive weight loss, severe skin elasticity. She was very unhappy, so we did a brachioplasty. I'm gonna show you the 6-week result on her. Very noticeable scar, very red. This is very common in fair skin patients. Still continue with your scar treatment, continue with the protection of the sun exposure, and this redness will go away. And I'll show you her final result at a year out is this one right here, and you can barely see the scar, okay? That redness, it's called hyperemic scar, is just a stage. You continue with your scar treatment, continue with the sun protection, and the scar will continue to heal. And as you can see here, the scar is almost unnoticeable, okay? And the other picture that I wanted to show you guys is this one. Another patient, massive weight loss. She didn't have a severe, but a moderate skin laxity here. And this is an earlier result, 6 weeks to 2 months post-op. And you can see this position, you can barely see the scar, right? It's on the bottom part of the arm, so, and very, very high, but very good in hiding it. But this is the reality, right? If you are walking with your arms on your side and you twist your arms, you're gonna be able to notice that scar. But again, we go back to, she's still in the early post-op, those scars are still very red, and like I showed you in the previous picture, right? This is gonna continue to improve and get lighter and lighter if she continues to treat that scar, okay? She's still very happy with her results because her goal was to get rid of that excess skin, so she's very happy with that. And I think going back, that's the most important thing, okay? I'll take some questions now.
Yay! Let's start with what kind of pain does a 360 BBL feel like?
A pain, you said?
Yes.
Okay, so pain is very subjective. Everybody feels different amount, degrees, and levels of pain, okay? The majority of the patients complain more of a soreness rather than actual aching pain. Usually the first few hours after surgery are usually the most painful ones, but usually the post-op day 1, they're okay with the level of pain. A lot of my patients have to take the narcotics the day of surgery, and then maybe day 1 or 2. Most of my patients, when I see them on post-op day 5, they say, I'm not even taking the Percocet anymore, I'm feeling a lot better, okay? So it's usually that first few hours, more like a soreness, tightness. Then usually with time, like I was saying, of the nerve endings healing, so it's normal to feel like pins and needles, the itching. I think it's one of the things that patients complain the most, usually like a week or 2 out. Once those nerve endings starts to heal, you start to feel a little itchy all around, and because the skin is still numb, that's usually the hardest part, because you scratch and you can't really feel it. We're getting this back, thank you. But Benadryl usually helps a lot with that itching in the early post-op period.
Okay, this one. Can we show you Wish Peaks and you will tell us if it's realistic for our body frame?
Of course. I really like Wish Picks. What I like the most about the Wish Picks is understanding what's in your head, right? It's very hard for me to, so if I take 5 patients there and the 5 said I want natural results, and then the 5 show me what they mean by natural results, it's 5 completely different answers, right? So that's why I like Wish Picks. I don't like Wish Picks to say this is going to be my result. I want this. That's impossible. That patient has different bony frame, different skin elasticity, probably different age, probably different history regarding pregnancy, surgeries, weight loss. So to say, if this is going to be my result, I want this, that's not a good wish pick goal, okay? But it helps me see what you mean by hips, natural look, foundation, volume. And with that, I can tell you, yes, this is something achievable with your foundation. This is something we can work towards. This is something that it's not going to work with you because this and that, okay? So of course I like wish picks, but it has its give and take there.
Okay, this one. I'm scheduled for a brachioplasty in March. I have excess skin and a large lump of fat on the side of my boob.
Okay.
Will an extend brachioplasty fix that? Or do I need to call to get my surgery adjusted?
So definitely give us a call so we can reevaluate your case specifically, but it sounds like you may benefit from an extended brachioplasty. It all depends on if the lump of fat in the side of your chest is more fat that maybe liposuction will take care of it, or it's a combination of excess skin and the fat that I extended. Remember that the extended and the brachioplasty, what it does mainly is remove excess skin, okay? We're talking about an excisional procedure. It takes fat away too, but its goal is to remove excess skin. So it depends, but definitely send us a message through Claire and we'll reevaluate your case.
Okay, and that links with this question. Can you talk a little bit about subaxillary liposculpture?
Yes.
Lipo?
Yeah, so that's an add-on that you can add to different surgeries, but it's basically excess fat in this area here and this area here, okay? It's a very common area that we all hate. I hate too. It's like a hard area to lose fat there. You lose 10 pounds, every fat in your body goes away except this and this. So I do understand. But usually those areas. It's a common add-on with Lipo360, with breast procedures, arm lifts as well. So yeah, definitely if you want to get evaluated for that, send us a message and the coordinator can help you out with that.
Okay, this is about brachioplasty. With tummy tuck and brachioplasty, is arm lipo done as well as flanks?
That's a very good question. Usually I don't do liposuction with my brachioplasty surgeries, but it depends. If you have thick arms, for example, on this patient, I did do arm liposuction with her brachioplasty because if you can see on her pre-op, she had thicker arms, okay? It was the thickness of her excess skin was more. So sometimes I do in order to thin it and I can tighten more, okay? And that way I was able to achieve this result, okay? A thinner arm because I did the combination of liposuction with brachioplasty. Not everyone, for example, on this one, she mainly had excess skin, not much excess fat, so no need to do liposuction. On her, same thing. She looks a little thicker, but it was mainly excess skin. So it'll depend. I'll let you know on the pre-op because it's something that I have to evaluate when I see you. But it's don't think that it's gonna affect with dramatically the amount of liposuction I can do with a tummy tuck because it's usually just a thin area where the scar is going to be in the arms. So the amount of liposuction that I do in the arms is not that much.
Are massages required after an arm lift?
Very good question. I don't recommend massages mainly because of the tension part, right? Remember that I said that tension plays a major role on the healing and trying to avoid wound healing problems and then in the long run hypertrophic scars. So applying massages is just going to apply more pressure and more tension to the scar. After 2 weeks, if you want to do self massages, that's good, but I don't think you'll need professional massages for arm lifts.
Okay, this Okay.
We're good?
Yeah,
Good?
we're fine.
Yes.
The swelling post mommy makeover and the weight roller coaster. What can we do? I'm 3 months post op.
Yeah.
Still.
Swelling post-op will happen, right? And it's part of surgery and it's part of recovery. What are the things that we can do to try to improve it? The compression, okay? The diet, and time. Those are the three things that are going to help with swelling, okay? 3 months, you should at this point see a very dramatic decrease in the swelling from early post-op, but there's still going to be swelling. And especially, you can visualize swelling. It's not that goes down linearly. It goes down and curves and curves. So you'll see days that you have more swelling, days that you have less, then it goes back up a little, but the trend should be to go down, okay? What are the things that you can do with your diet? Continue a healthy diet, okay? That's so important. I think that sometimes people think of plastic surgery as a one and done deal, but plastic surgery should be just a piece in the big puzzle of body improvement and improving yourself, okay? If you do see plastic surgery alone as the solution to everything, you're not gonna be happy with your results. Plastic surgery should be just one component of everything that you change in your life to make sure that you improve with time, right? Diet, exercise, lifestyle changes. So all of that should contribute to your final result in order to, one, feel better, look better, and for that look to last.
The last one.
Yes.
Hi, Dr. Vidal. How many days is recommended to take off work after having a lipo 360 plus BBL? And also she says, thank you.
You're welcome. So how many days out of work depends on what you do, okay? So for lipo 360 BBL, at least 2 to 3 weeks you're gonna need for the initial recovery and for the initial massages that you're gonna need. At first, remember that you're gonna need massages every day, okay? And you're still gonna feel weak and you're still gonna feel a little tired once you start doing stuff, okay? So take 2 to 3 weeks. After that, there are gonna be some limitations, okay? So it depends on what you do for a living. The limitations are gonna be no heavy lifting, no more than 10 pounds for 6 weeks, no strenuous activity for 6 weeks, and no sitting for 6 weeks unless you're using the BBL pillow starting at 2 weeks, okay? So if you are doing desk work, but you can use your BBL pillow, then most of the time you're gonna return to work at 2 to 3 weeks. If you are a wrestler professionally, then you shouldn't return to work until you're 6 weeks out, okay? You get the point. But those are the limitations and those are the restrictions. That's it, you guys. Thank you so much for all the questions. Hope this helped out. Seeing if you're a candidate, seeing if you can, if you're gonna be a benefit from having the surgery, and also if you're having the surgery, what are things you could do to improve your results? If you have any other questions, send me a message, and I'll see you guys next Tuesday with Tuesday Tips with Dr. Vidal.